Assalamualaikum. Welcome to you all to my today's lecture. I am Dr. Abdur Rahman Rana, Assistant Professor, Department of Pharmacology and Therapeutics at the Akij Medical College, Boyra, Khulna. My today's topic is Introduction of General Pharmacology. What are the things that discussed about general pharmacology? History and sources, drug nomenclature, dose and doses, dosage formulations, routes of drug administration, drug interaction, mechanism of action, adverse drug reaction of oral drugs. First of all, we will discuss about the history of pharmacology. The birth date of the pharmacology is not clear cut. In the early 19th century, the physiologists performed various studies about the pharmacology. Thus, the Francis Magendie studied the action of Nux vomica on dog. It shows that the spinal cord are the site of its convalescent action. Then various scientists performed various studies about the natural plants regarding their effects on the living plants or living organisms. And then the new era has developed in the modern pharmacology. The pharmacology then emerged as a separate science only when the first universities here was established. Then the Rudolf Buchheim created his first pharmacology institute in his own house in Estonia, the part of Russia, in 1847 due to lacking of fund. Then the students of Rudolf Buchheim, the Oswald Schmidberg, the full-time occupant university professorship of pharmacology, usually considered the founder of modern pharmacology. He discovered the blood concentration of the chloral hydrate and chloroform. Then in the 20th century, the fresh wind of synthetic chemistry began to revolutionize the pharmaceutical industry and with it the science of pharmacology. Now today's the boundaries of pharmacology is not sharply defined nor clearly they constant. And now we'll discuss about pharmacology. What is pharmacology? The pharmacology is derived from the Greek word pharmakon, that means drug, and logos means study. That we simply say that the pharmacology means the study of a drug. The various books is described the pharmacology. Important book in the Indian subcontinent is Bertram G. Kajang. It is defined as pharmacology can be defined as study of substance that interact with living system through chemical process, especially by binding to regulatory molecules and activating or inhibiting normal processes. Another definition also we can define Dr. Misbah-ud-Din sir. Sir defined the pharmacology a branch of science that includes history, source, physiochemical properties, dosage form, method of administration, absorption, distribution, mechanism of action, pharmacological effects, biotransformation, excretion, clinical use and adverse effect of drug. This the two definition is very important for Viva. What are the branches of pharmacology? Various branches of pharmacology. Main important branch is clinical pharmacology. Clinical pharmacology discusses about it has two parts. It's pharmacodynamics and pharmacokinetics. Therapeutics, this is medical pharmacology, pharmacy, toxicology, pharmacogenetics, immunopharmacology, behavioral pharmacology, pharmacoeconomics, chemotherapy, comparative pharmacology, pharmacometabolomics, pharmacogenomics, neuropharmacology, psychopharmacology, etc. What is clinical pharmacology? Clinical pharmacology is very important, asked by the Viva board. It is the branches of pharmacology which deals with the scientific study of drugs in human for their safe and effective use. Pharmacodynamics. Pharmacodynamics means what the drug does to the body. Simply we can say that the biological effect of drug in the body. Another definition is it is the branches of pharmacology which deals with the biological and physiological effects of drug and their mechanism of action. This is very important for Viva. And another is pharmacokinetics. Pharmacokinetics means what the body does to a drug. Comes from the word pharmacokinetics comes from the Greek word pharmakon means drug and kinetin means move. After administration of a drug, it goes to the systemic circulation, then it goes to the site of action, then same time it goes to the liver for metabolism, and after metabolism it goes to the kidney for excretion. That's why it moves occur. Then we can say that the study of absorption, distribution, biotransformation means metabolism, and excretion of drugs is called pharmacokinetics. What are the importance of clinical pharmacology? Clinical pharmacology integrates the therapeutics with the basic principles of pharmacology, research methodology and biostatistics. And also it evaluates the pharmacological effects of the drug, preferred rate of administration and safe range in human clinical trial. Then the figure shows that after administration of a drug that absorption occurs, then that goes to the systemic circulation, then concentrate to the site of action, then it produces the pharmacological effect. This is desired effect and undesired effect. Desired effect that produce is the effect of drug, and undesired effect, this is the adverse effect of drug. Those discussed about the pharmacokinetics, and simultaneously that goes to the site of action that produce the effect and mechanism of action of drug, and that is discussed about pharmacodynamics. Then what is therapeutics? Therapeutics is means the branch of pharmacology which deals with the use of drug in human body to detect, protect, control and cure of disease. We will discuss about pharmacy. What is pharmacy? It is concerned about the preparation, compounding, dispensing of chemical agents for therapeutic uses. It includes three terms. It's pharmacognosy, pharmaceutical chemistry and biopharmaceutics. Pharmacognosy means the source, identification, isolation, purification and standardization of a drug. And the pharmaceutical chemistry means the synthesis of a new drug, and biopharmaceutics means formulation of the drug. Those three things are included in the pharmacy. What is toxicology? Toxicology means branch of pharmacology which deals with the study of adverse poisonous effect of drug on the living system and their management. Pharmacogenetics is the study of genetic variation that causes difference in the drug response among individuals and population. What is immunopharmacology? It is the newer branches of pharmacology. Immunopharmacology means branch of pharmacology which deals with the immunological aspects of drug action, including effects of drug and immune response and development of antibodies in response to drug. Another newer branch is behavioral pharmacology. It means the study of how the drug affects the behavior of the patient, also called the psychopharmacology. The pharmacoeconomics, another newer branches is pharmacoeconomics. It is the study of the cost of the drug by medicine that's taking into account. It is called pharmacoeconomics. And pharmacoepidemiology. Pharmacoepidemiology is another newer branches of pharmacology. It is the study of both beneficial and adverse effect of a drug on a large number of population. Then another definition is chemotherapy. What is chemotherapy? Chemotherapy means the branch of pharmacology which deals with the effect of a drug on large microorganism, parasite and also cancer cell. Another definition is comparative pharmacology. What is comparative pharmacology? Comparative means comparison. Deals with the comparison of one drug to another drug belonging to same or different group. Is called comparative pharmacology. Another definition is pharmacometabolomics, also called pharmacobetaomics, refers to the quantification and analysis of metabolites produced by the body. And pharmacogenomics. Pharmacogenomics means refers to the application of genomic technology to discover the new drug. Is called pharmacogenomics. Another definition is neuropharmacology. Pharmacology means how the drug affects the nervous system of the patient or person. Psychopharmacology means the behavioral pharmacology that affect the behavior of the patient. Is called psychopharmacology. Now the important thing is drug. This is very important term that our definition is used in the viva or written. Very important. Drug. What is drug? The drug term where comes from? Term comes from the French word drogue, which means a dry herb. In the most general sense, a drug is defined as any substance that brings about a change in the biological function through its chemical action. But the WHO, World Health Organization, defines the drug is any substance or product that is used or intended to be used to modify or explore the physiological systems or pathological states for the benefit of the recipient. This definition is very important for viva. What are the properties of a drug? Properties means various things. It is physical nature. A drug's certain physical nature means solid, aspirin, liquid, gaseous formulation. Chemical nature of a drug, this is acidic, basic and neutral. A drug must have the appropriate size, electrical charge, shape, must have property to transport it to the site of action. This is ionizing constant, partition coefficient. Drug must have to bind to the other drug's receptor or plasma protein and have structural activity relationship. Drug have three principal ways. This is to cure the disease, to suppress the disease and to prevent the disease. Then what are the uses of a drug? That is the 5 terms we use in case of the use of a drug. As for example, to diagnose the disease or detection of the disease. Diagnosis of the disease, as for example, in case of achlorhydria, to use of histamine to detect how histamine increases the gastric acid secretion ability. as for example Hydrophonium for Myasthenia gravis and others. As to prevent or protection of the disease, we use vaccine for the prevention of various communicable disease and serum toxin and toxoids. To control of the disease, we use various drugs for the control of the disease. As for example, we can use insulin for the control of diabetes mellitus. We use antihypertensive drug for control of the hypertension. To cure of the disease, for various antibiotics we use for treatment of the bacterial infection, diuretics used for the treatment of the edema, analgesics we use for the treatment of the pain, and alternation of the normal physiology of the cell. As for example, we use oral contraceptive pill for a woman to prevent conception. And what is medicine? Medicine means preparation containing one or more drug which has definite form, dose, supplied in a suitable container with appropriate labeling for treatment of disease and used therapeutically for treatment of the recipient. And what are the difference between drug and medicine? Drug, any substance or product that is used or intended to be used to modify or explore the physiological systems or pathological states for the benefit of the recipient. And medicine is the preparation containing one or more drug as definite form, dose, supplied in a suitable container with appropriate labeling and used for the treatment of the patient. Component: drug must have containing the active ingredients, but beside this, medicine containing excipients. Drug is used for diagnosis, prevention, treatment and control of the disease, and medicine only used for the treatment of the disease. Drug have no definite form, but medicine have the definite form. Dose: the drug have no definite dose, but beside drug, medicine has the definite dose. Relation means the all drug are not medicine, but all medicine are the drug, and all the drug is prescribed in generic form. And nowadays in this Bangladesh perspective, all medicine is prescribed as the brand name. Thanks to you all for watching my lecture.